Anticipation. Is it counting? When I come in last. Oh, that is sabotage.
Right, rigid border-like abdomen. So once that perforation occurs, it's gonna go out into our abdominal cavity. So we can have some bleeding, some excess content from our food, digested type stuff. So we're gonna have the rigid abdomen, feels like a board when we press down and we're inspecting our abdomen. Yeah.
Oh. Boom.
Oh, wait a minute. Now, Fuller said we could add up to 20 minutes. Some could be 20, but it's usually.
So there's kind of mixed things. We are going to put 10. That's kind of a bad wording question. That's my bad, guys. But 10 is going to be our standard for the amount of water that we're going to inflate our balloon with. After that, we probably need to let a physician know, get an order to inflate our balloon further. We don't want to cause any extra trauma within our urinary tract. So 10 is going to be kind of our standard. Yes, Mr. Fuller also said 20. Okay. These are pretty straightforward.
I'm trying to help a friend.
Alright, to secure the catheter in the bladder, we're trying to get that good adequate seal so the urine goes inside the urinary catheter and not around the balloon itself. Recommended size of Foley catheters. 16 French.
It's just like I didn't do it.
The bigger the number, the bigger the size of the catheter and diameter. It's going to get bigger and bigger. More of the bladder type surgeries, prostate surgeries, urethra type surgeries, they're going to go for a bigger size. We're trying to reduce the risk of clots from forming and an obstruction.
Is there 18?
18 would be bigger.
I've never seen any. What's the biggest?
I guess I've never seen the biggest one. All I usually grab is a 16. But they put in surgery, it can be bigger.
No, but it's like you didn't say it in line.
Especially with the three-way irrigation type Foleys.
Oh. What is the meaning?
The main deciding factor, why would we pursue treatments or why would we not pursue treatments?
I don't know if my answer's right. I felt like I felt very raw. I mean, if I spelled it wrong, Mr. Frank, and I spelled it wrong. Why would you spell it? I haven't been able to spell lately. Which one's right? Hey,
Quality of
wait,
life.
no, wait. I put it in lowercase. I did too, it's
Oh, never mind.
Severity of disease, muscular atrophy, no treatment, just because. Alright, so we're gonna have to really determine what our quality of life is gonna be. Whether it's, for instance, if they want a trach or not, it's really up to the patient's decision on what their quality of life would be afterward. Is the family member's gonna have to take care of that trach? Are they gonna have to take care of maybe the peg tube? Does the patient want that at all? Or do they just wanna live their best life and not have to worry about it, and however they end up is how they end up? So it's the quality of life, the quality of care that they want. It's all based on the patient.
Look at you go, Brainiac.
Signs and symptoms.
I'm not sure.
Calf enlargement, Franklin's Falls and Gower's maneuver is gonna be your initial presentation for your signs and symptoms. Later on, involvement is gonna be your cardiac and respiratory, so that does count as well. But that's more for your late stages of your Duchenne's muscular dystrophy. So,
Oh, I'll show you. Oh.
What do you mean what are the stages? It's all.
okay, then that's fine.
That's not like a trick question, I'm scared.
Hopefully I did it right, we'll see.
I feel like one of these is wrong. No,
Hey,
I thought that was a trick question.
I think it's wrong that you
was-
skipped stage 4.
why not cross that off?
Oh,
Oh. Did you remove me?
another multi-flex. Oh, I misspelled that one. Just because it's misspelled doesn't mean it's not wrong.
Perform CPR. They are indeed dead.
I like it.
What if they have epilepsy?
On
Why are you
initial-
calling 911?
If you're at Walmart, you're gonna ensure safety, and you're gonna call 911.
What if they have?
But they have them all the time, but you said at one point in time, you only call 911 for whatever the reason was.
You can call 911 if you want to call 911.
I'm not.
I'll call 911 right now.
What if they have epilepsy?
Well, what if I end up 911?
What is it?
Did it say you were 911? No.
Listen.
Where's Sam at? I'm about to remove her from this.
Please.
Do not remove me.
Oh, yes, I'm
Technically, yes, it is a genetic mutation, but is a mutation of the dystrophin protein.
I feel like that's what was this. I feel like dystrophin was more accurate. Quit it. That's why you should look me after I help you. You told me too late.
A is making a comeback. All right. Let's see. Another multi-flex.
Why?
I like green. That's a good answer.
That is I can't see over Chesapeake head.
Make sure I'm not getting out because I think we all in the same boat.
All right, relapse remitting, primary progressive and secondary progressive. Randy with the pills.
Randy, oh my god. Oh, it's fine, he did.
Sam, what was your patient feel today?
test?
What's that?
The music. How ever you sing out of test.
I feel like they're.
Little
I feel like
increase.
we did that before. I feel like a week or. Didn't we just do that? I know, like.
No,
What's
no, no.
the question?
Signs
Oh, I thought this was like a reply to.
and.
Wait, no, I thought it was more.
I thought it was choice too, I was like, which.
And then my thing started spinning, I was like,
But
oh,
too, I put that.
It's not fair because we thought that.
You didn't get the question fully, I'm sorry, that's.
I mean, you didn't put multiple choice.
Oh, bless you.
You just kicked me
I'm
off.
playing with Meredith.
Yeah, just was, yeah. When was that week? I don't know.
Alright, tonic seizures, that's when we're thinking about the rigidity, the stiffness, that kind of just clamp down, within the bed.
Oh, that's gonna be a chronic or it could be tonic. Tonic, chronic. Yeah, just so okay.
The signs of tonic seizure.
Oh, wait, I think about it.
Did something.
So what's the brick checking?
Brief jerking with stiffness of the extremities, that's gonna be your tonic clonic type seizures. Just the rhythmic jerking is gonna be your clonic seizures.
So the rest tonical?
Yes. This causes increased stress.
It helps with my ADHD, I don't know why.
Ostalinlavir, that's your Tamiflu, one of your common ones.
Yeah. I studied it later than this.
Sign of an active duodenal ulcer.
You said you really like this line.
Because it makes the gastric contents more.
Pain relief by food. So we gotta remember our duodenal ulcer is right past where our stomach is, right there past that pyloric sphincter. So if we eat our food, it's actually going to kind of dilute out the gastric pH, that acidic part of our gastric contents. And it's actually gonna be a buffer for our gastric contents. So pain relief by food. Good, metabolic alkalosis. We're getting rid of all of our pH. Getting rid of all of our acidity out of our stomach when we're throwing up, we're doing that projectile type vomiting. And so we're gonna be more alkalotic in nature.
All I think about is Mr. Overseas.
Metabolic alkalosis.
Yeah, that's all I think about.
This is a multiple choice question, so.
Thank you.
Well, okay. Always hungry and their projectile vomiting is usually gonna be formula based or breast milk based. As soon as they eat, they digest just a little bit and then they're going to projectile vomit it back up. That's why they're always hungry. There's no time for absorption to occur. dyspepsia, right, indigestion, heartburn, type pain. These are real generalized, but this kind of gets you back in the mindset of thinking about what we need to look at for our tests. Perfect. Maternal smoking. Very similar to the one we just answered.
What's the photo?
It is a catapult.
It's a catapult.
Wait, that's funny.
Projectile vomiting. Don't get my humor, that's okay. Chest pain.
Skin rash.
Let's give it a hash. Oh, somebody's finger slipped. That's all right. Chest pain. So it can really mimic a heart attack. Remember where our esophagus, our gastroesophageal reflux disease occurs, kind of within that esophageal lining, which is very similar to around where our heart should be. Okay.
Should be.
Should
I mean,
be.
you can have your heart on the
You can have it on the opposite side. I have seen it as well. One of my good friends, their daughter had complete opposite of everything. So,
What?
Does it have like twins?
what now? I cannot remember what it was called.
I think it is called mirroring.
But yeah, everything is on the opposite side.
I know, we probably should, isn't it a twin thing? Just skip them. Just skip them.
All right, boy, triggering foods. What kind of foods would be triggering for our GERD?
Spicy.
Spicy type stuff, sauces, orange juices, alcohol, coffee, grease, all the good food we eat in the South, pretty much all that. Plain, non-tasting food.
Cardiac.
The cardiac food, yeah. That's,
My finger slipped.
okay, bacterial infection.
Shouldn't that also be a sign?
It could be, but bacterial in nature.
Love is human. Ooh, ooh. Oh, I quit. I can't click the red one. I can't look up there.
Green eye, okay. Remember, you can pack up and you can go home.
I get the yellow eyes.
Coordinating right.
Please don't miss that on your test.
It was even appropriately colored.
Oh, I misspelled that one too. I tried to change it. Usual.
I gave y'all something really good.
Right. Bacterial is bilateral. It starts with a B. Both eyes.
You forgot
Bacterial
the
both.
Y.
I did forget the Y. I'm very sorry. Viral conjunctivitis. That's going to be usually, typically unilateral in nature. All right. Chlamydial is the same thing as viral, and then allergic reaction on the end.
I like appendectomy for this one, people.
All right. Rhingiotomy, good. Pyloromyotomy is going to be where the surgical procedure for the pyloric stenosis, where we cut that extra little muscle, that outer band, to relieve that stricture around the pyloric sphincter. Cholecystectomy, gallbladder, appendectomy, appendix.
A loogie tube. Now, the picture really rubbed you the
That's what I blew up this morning.
Who has that?
That wasn't me, it was a random generated.
You should probably quit doctor
Because you might have tuberculosis with that red looking stuff.
Alright, Lukens tube,
A loogie tube.
or Lukey tube.
That makes me want to. I hate spring.
No, I think I put them on one. You probably did. Should've been A. It's contagious. Contiguous. I don't know.
No, it's just like, you guys are.
Exogenesis.
I don't like that because I didn't get it.
So some type of bacterial, some type of pathogen was outside of the body and then was introduced inside the body. Some type of open wound, open fracture, trauma. Endogenous or that hematogenous, so it's blood type infection has traveled to that site. Contiguous, right around the same area. Almost there, guys.
Dang. LOL, I think I'm
Did
gonna.
you pick green eye again?
Oh, okay, I got it right.
No, I picked blue and I wanted to pick green.
Dormant phase, it's not active. It's laying up, it's laying dormant. It's kind of just hanging out for now.
My finger's not doing it.
Your late phase and when it's actually occurring.
It's because you need a nap camper. I do need a nap.
All right, we're typing in answer.
What? I just know it.
The size of induration for immunocompromised patient.
I don't know what it's asking.
I don't know
What
that.
size of induration do we need? You say they have TB, just the number.
I didn't put just.
What is it? The size. I'm scared.
The size of a little bubble.
I put 5 cm. I put 5.
He said just the number.
He didn't say half, I'll put it again.
I put my cm up there. I
I'm
put 5.
not getting 5 cm because it's not centimeters.
That is incorrect.
It's 5 millimeters.
But I put 5.
Units matter, so we're gonna take that. 5 mm. I like them. So we're gonna go with.
I feel legit. I put 5. I put centimeters too, so.
5 for immunocompromised. Anybody that's healthy, normal adult is gonna be 10. Anybody that is from overseas or in some type of facility, a group home or jail, that's gonna be more than 5 millimeter mark.
I better make bigger on this. True or false?
True or false?
Oh, this is a tricky one. What can it be?
Like he had a stop.
Viral conjunctivitis typically is gonna be unilateral in nature. Yeah, that wasn't conjunctivitis, that was just a stop.
I need a bed.
True or false? Oh, fuck.
Alright, pain with urination is usually for an UTI.
I'm guessing you're the one.
Yes.
Alright, green eyes and false over here.
Oh, obviously, we were like 17 and 18 on this, Amber.
right, remember, children are more prone to otitis media because of their short eustachian tubes. They have shorter, wider eustachian tubes for their anatomy. As they grow a little bit older, our tubes start to lengthen out. They start to get a little bit narrower. Narrower.
I had tubes in my ears. That's so cool. Thank you.
Now you just point away.
Sounds like a type of
Reflex.
Yes.
Reflex.
Reflex.
I did not put arrhythmia.
A Mantox test, yes, we will see some erythema on our TB skin test. But that's not what we're testing, we're talking about the induration. The specific test is your TB skin test or your
The
Mantox
reflex
test.
test.
I think I just gotta lose.
I need to know who Randy with the application pneumonia began outside the hospital.
Type your answer on this one. Classification pneumonia that began outside of the
Wait, I
hospital.
forgot how to spell it.
I'm good at that. High five.
Will you get it close?
Yeah.
Can I spell it close?
I don't know.
Can I look?
How close?
I can't spell anymore because I started nursing school.
Yeah, don't talk.
I don't think I spelled it right.
Oh, bam.
You know what? It's true. It's true.
Community.
I'm like,
Communal, we're not, that's breaking bread at church.
Just pass it.
Please, I tried.
Community acquired with those.
I did the acquired. That was community. But you know you would get the red one.
Awkward.
Come on. You not get this.
No, I didn't get my 5. That's not fair.
Communable.
Oh my. Community pneumonia.
I guess technically if you do community, we'll go with that. No, not that one.
I mean, you can get it from church.
You got it. I just kind of freaked out to get it.
Oh my. Oh yeah,
It's really tough on the spelling.
we know Amber thought
Good
of
job, Haley.
I was bored. I'll take it.
Good job, Kamaya.
Ooh, okay,
And Zach.
Randall. Nope, Natalie. Good job. Good stuff.
Randall?
I know.
I need to know who
Yeah,
Randy
I made
with
it,
the
I made
pills.
it close.
Oh, that was
Zach.
That was good.
Zach, is this a guy that?
Alrighty, does anybody have any questions about
It's a
the
whole
test
story.
coming up?
Zach.
The
What they
patient?
need to review?
Every Zach.